there to help you how to choose your oral rinse. What's the useful one for you to get the maximum benefit? First of all, before we talking about the oral rinse, it's not the mainly tool to use it for your mouth hygiene. First tools to keep your mouth with good oral hygiene using the dental floss and teeth brushing. If you want to get third option, you can use the oral rinse. Usually we can clean our mouth by mechanically, like dental floss, teeth brushing. Oral rinse, it's chemically mouth fluid. We can use it to specific condition. Sometimes we can use it for daily use. Here's the three major oral rinse products it's available. First of all, therapeutic. Therapeutic we mean by chlorhexidine gluconate. This is the active ingredients. Usually we prescribe it as a doctor for specific condition like gingival inflammation, mouth ulcer, sometimes oral thrush. It's a longer duration. It's touching the tooth for longer duration than the others, but it has some side effects. We should use it for specific period, like maximum 2 weeks. We should not exceed that. If we use it for a long time, we're talking about chlorhexidine gluconate, we will get some side effects like staining of teeth or dental restoration, also some alteration of our taste, increasing in calculus deposition. Second type, it's phenolic compound, which is called essential oils. Contains ingredients like menthol, anthimol, and eucalyptus. It's a very usually it's not available. Sometimes it's available outside our country. KSA, it's alcohol containing alcohol with a percent like to 20%. We prefer as a doctor to don't use it for a long time because it has some side effects like drying or burning the soft tissue. In our country here, we have like this family type, but it's alcohol free. Later on, we will take some example, explain what's the product name maybe of each family. Third type, it's cetylbaridium chloride, usually used for the mild odor. Some patients they complaining of mild odor of our mouth. They doing brushing, but still they complaining. So maybe we can use this one like a daily use, but with less effect for the anti-plaque and gingivitis than the others. I try to get some products. Available in our country here, in our pharmacy. In outside pharmacy. Like if we're talking about chlorhexidine gluconate, we will find a product name like called Parodontax Extra, which is the down picture shows the active ingredients, the chlorhexidine dichlorobenzene. If we're talking about phenolic compound, we will see Listerine. Listerine here in Saudi Arabia, it's alcohol free, but outside maybe you can find it. It's alcohol, some of them alcohol containing. Third one, which is the most of the mouthwash available, it's from the cetylbaridium chloride family. How to use the mouthwash? Usually, if we're talking about therapeutic, which mean chlorhexidine gluconate or also bavudine, iodine, it's prescribed by a doctor. Here in our, here in case A, it's available for without a prescription, but usually don't use it without any dentist prescription to avoid any side effect with long use. The daily use, the daily use mouthwash, we can use it twice daily for a long time. We should prefer, we will try to don't use it directly after the mouth teeth brushing. Teeth brushing, or most of the tooth paste has material called lyocell sulfate. Usually it's prevents the effect of the mouthwash. So if we can keep period between the teeth brushing and the use of the mouthwash like 15 to 30 minutes, it's better to get the benefit of all of the teeth modality of treatment. Here I write my reference if you want for further details. And we have question, what's the maximum use of therapeutic mouthwash? We're talking about chlorhexidine glycinate and povidone iodine, either A, 2 weeks, B, 2 months, or 2 years. And that's it. Thank you.
Thank you.
Thank you.
You know, you have raised the point of most of the people after brushing their teeth, they start to do the gurgling, which is wrong.
Yeah. Yeah, because some studies, yes, shows some toothpaste has some
all
materials.
all types of toothpaste.
Yeah, especially chlorhexidine.
Thank you.
Only as a doctor, I don't recommend it mouthwash. Try to focus on dental flossing, teeth brushing. If you have ability to use the daily use, it's okay. But the mechanical ways of cleaning your mouth, it's better than the chemical.
By now we have ended the lectures. Thank you for being patient. We will have a half an hour of discussion. Later on, the questions, the 6 questions will be added in the link, and it will be open for half an hour. You can answer them and submit in order to win the prize, inshallah. If there is any questions, please.
Yes, can I ask a question, please?
Yes, go ahead.
Okay, I have 2 topics actually, which is I have a question about. The first topic is the HPV, which you mentioned already. It's mostly affecting girls. I wonder why the ages between 9, 11, and 12 is the most important time to have this vaccine for them.
Yes, very good question. Usually the aim is to protect the girls from getting the cervical cancer, which is transmitted sexually. So we are giving the vaccine before the marriage age. So we want to protect the girls before the age that she gets married and she may get in sexual contact, then she can get the transmission of the virus.
That means you cannot give it to them an earlier age, like in the vaccinating card when she's a baby, or like the first 6 years, like normal vaccines?
No, it's not giving childhood, because usually the vaccines, they have to be taken as a shot and a booster shot to get the, so if you give it very early, maybe the immunity by the age of marriage will be weaned up. So we have to give it in the correct age, near the marriage age. Then we can give another booster later on. It will be more effective.
Thank you. The second question concerning the second topic, which I have a question about, which concern monkeypox. I have a question. It has been almost 30 years from the 17 to 2000. It's sleeping virus. We didn't see any peak until the 2000 started to raise up in Africa and Europe. My question is, with the number which is up today, I mean, just raised right a few weeks, 1,000 patients comparing to the population worldwide, I don't think so. It's a major disease. Is you compare it the chickenpox or different? Yes.
Because there is some, they consider there is some genetic alteration in the virus, and maybe it is responsible for that. It is to transmit it more between humans, and also it is different from the chickenpox. The chickenpox, it is a different from different family of viruses. It is actually the chickenpox from the herpes viruses. It is different family, and also it is transmitted by aerosol, and it is very common. The monkeypox, it is from other class, from other family of viruses, and as we said, for long times it is just considered animal disease and with occasional transmit to humans. But with time, maybe the virus, it is what we call for genetic alterations. It has possibility and for more spread from human to human, especially in the last year. This year, the WHO reported more than 1,500 in Africa, in the endemic areas, and until now in the outside Africa, during 5 months, they reported 4,000 and more than 4,000 confirmed cases, and it is unusual before, before.
Yeah.
But the WHO until now it is considered it is not it is moderate about not like what we call the coronavirus should be alert or mass vaccines or like that because they found that the disease is limited in persons who very close contact, as actually now most of the cases in the world reported it is between men who have sexual with men.
Very
And all the countries.
clear. Thank you very much.
Any other questions? Dr. Jaffer, I want to ask a question, please. Is all type of animals can transmit the disease, or certainly how can we? You said rodents have to carry the virus, so usually it's not eatable.
Yeah, this is the problem in the zoonotic disorders. If we discover what is the result for that. In the monkeypox until now, more than 15 animals.
Sheep, for example?
Yes, they reported they had the disease.
Yeah, even sheep, chicken can take the virus.
Yes, but until now it is uncertain. The disease can be transmitted from human to animals. This is the big problem. If it is transmitted from human to animals, it will be endemic all over the world because in the animals we cannot eradicate easily.
Any other questions? We will add the question form in the link. You can start answering and submitting your answers.